Bismillahirrahmanirrahim. Today, our first question is you have been asked to review a 54-year-old woman with a 30-year history of paranoid schizophrenia with multiple hospitalization, usually preceded by cessation of antipsychotic medication. Her mental state reveals that she is suspicious, guarded, and grandiose. She believes that she has a unique healing powers and can communicate with angels. She is insistent that her experiences are real and that she has been falsely labeled mentally ill and does not require any medication. Her insistence that she is well and not in need of treatment is an example of which one of the following. The options are the therapeutic delusion, artistic thinking, formal thought disorder, impaired insight, poor treatment compliance. Impairment of insight is not a pathognomic of schizophrenia, but initially almost all individuals with schizophrenia have this features as a manifestation of their illness. It is not necessary for the diagnosis, but if it persists, it then affects compliance with treatment and contributes to a poorer prognosis with more hospitalization and compulsory treatment orders. Insight referred to the self awareness of a situation and the acknowledgement of symptoms, illness, and the need for treatment. So, option D is correct. Insight is a dimensional, and some individuals may concede symptoms or abnormal behavior but refuse treatment or hospitalization. In psychoanalytic context, it has a broader meaning referring to an understanding of the dynamic factors at the root of symptoms and behavior which leads to cognitive awareness and emotional freedom. This woman's belief is not a therapeutic delusion but is a symptom of her disorder independent of her other abnormal beliefs. All her beliefs may be idiosyncratic, they are not characteristic of autism, nor are they indicative or a disturbance of her thought form. Impaired insight is not always consistent with a poor treatment compliance. So option option D is correct, which is impaired insight. A 26-year-old woman has presented for her first antenatal checkup at 20 weeks of gestation. She tells you that she is psychic and clairvoyant, has a magical connection with cosmos, and has been undergoing past life therapy for her beliefs in reincarnation. She has been on a idiosyncratic, organically based diet during her pregnancy and has timed her pregnancy to fit in with numerological and astrological conjunctions. She is unusually and colorfully dressed and uses languages in an unusual but easily understandable way. She is neither thought disorder nor hallucinated. Her beliefs are an example of which one of the following. So there are certain beliefs they have mentioned. The options are COVID syndrome, paranoid schizophrenia, schizotypal personality disorder, mid trimester madness, cyclothymic disorder. Individuals with schizotypal personality disorder are characterized by odd and eccentric behavior, beliefs, dress, and use of languages. So option C is correct. They usually lack close friends other than relatives and may have a marked social anxiety associated with ideas of reference. Typically, they describe themselves as a psychic or having a sixth sense and may practice clairvoyance and fortune telling. Employment is difficult because of their social ineptitude and suspiciousness of colleagues. They may be poorly groomed and unkempt and dress in unconventional ways. Usually, they are aware that they are different and don't fit in. The disorder is a part of the schizophrenic spectrum, and the Relatives may either have a schizophrenia or other forms of psychosis, or also be a schizotypal. It's usually apparent by adolescence, and individuals may be bullied and underachieve because they are obviously different and non-conformist. Covid syndrome is one of the is a French term which refers to symptoms experienced by the male partners of expectant mothers, typically beginning at the end of the first trimester and lasting until the childbirth. The father may experience indigestion, appetite change, weight gain, abdominal bloating, constipation, toothache, and abdominal cramps. It may also occur in the siblings and parents of the expectant mother, while uncommon mild forms are not rare and may be related to anxiety or identification with the pregnant mother. This is clearly not the correct response in this scenario. Paranoid schizophrenia is excluded because this young woman does not have either delusions or hallucinations. Mid trimester madness does not exist as a separate diagnostic category, and there is no evidence that this woman has a cyclothymic disorder, which requires the presence of at least 2 years of numerous hypomanic and depressive episodes, which are not severe enough to warrant a diagnosis of bipolar disorder. So, option C is correct, which is schizotypal personality disorder. A 18-year-old student fails her driver's license test because of poor vision. She said that she can read well and does not suffer from headache, but admits to difficulty seeing at night. Her visual acuity is right 6 by 24 and left is 6 by 36 on Sentinel chart, correctable at to right 6 by 6 and left 6 by 6 with 1 pinhole. Examination of her ocular fundi and ocular pressure tonometry are normal. Which one of the following is the most likely to correct her problems? Vitamin A 50,000 IU orally daily, orthoptic exercise, convex lenses, concave lenses, or cylindrical lenses. Vitamin A deficiency causing night blindness is a very unlikely diagnosis, and unfortunately, orthoptic exercises are usually ineffective for refractive errors. This teenager has the refractive disorder of myopia, which is short-sightedness, and visual acuity is right on right side is a 6 by 24 and left 6 by 36. Using a Sentinel chart, which is illustrated here. So this is the case of myopia, which is short-sightedness. This myopia is a short-sightedness. The eyeball is too long and more distant objects are focusing in front of the retina. The nearer the objects comes to the eye, the further back the image falls. So focus images occur for near objects but not distant ones. To correct the refractive error of myopia, glasses which is concave lenses are thus required to focus distant objects. So option D is correct, which is myopia, and this concave lenses are used. So concave lenses is one of the correct option. When using the ophthalmoscope to view the myopic retina, a negative diopter concave lens is required. Hypermetropia, which is long-sightedness, occurs when the eyeball is too short. Distant objects focus on the retina, but closer objects cannot be focused adequately by accommodation. Convex lenses are required to bring the retinal image forward. When viewing in a hypermetropic retina, a positive diopter convex lens is required. So for long-sightedness, convex lens are required, and for myopia, nearsightedness, concave lens are needed. So in this option, correct answer is the concave lens, because this is the myopia. So here I will show you the picture for clear understanding. This is the normal eye. Distance rays focus on the retina, you can see, and this one is the myopic. In myopia, which is short-sighted eye, the eye is too long. Distance rays need concave lens to bring retina in focus. This is the concave lens, and this is the convex lens in which is used in the hypermetropic long-sightedness. The eye is too short, distance rays can focus on the retina, but convex lens is needed to focus objects on the retina for closer vision.